Should I be concerned about bleeding 10 days after the period? When should I see a doctor?
Hello and welcome to our health discussion today. In this video, we will be addressing a common question many women have. Should I be concerned about bleeding 10 days after my period? And when should I see a doctor? This is an important topic, as it relates to your personal health and understanding the normal functioning of your body.
What is normal menstrual cycle?
First, let's understand what a normal menstrual cycle looks like. The menstrual cycle, which is counted from the first day of one period to the first day of the next, isn't the same for every woman. Menstrual flow might occur every 21 to 35 days and last 2 to 7 days. For the first few years after menstruation begins, long cycles are common. However, menstrual cycles tend to shorten and become more regular as you age.
What can cause bleeding between periods?
Now that we understand what a normal menstrual cycle looks like, let's talk about the causes of bleeding between periods. Bleeding or spotting can occur for several reasons, and it's important to know that it isn't always a cause for concern. Some common causes of bleeding between periods include hormonal imbalances, stress, changes in weight, certain medications, and in some cases, more serious health conditions.
When should you be concerned?
The key question we're addressing today is, when should you be concerned about bleeding 10 days after your period? While occasional light bleeding or spotting can be normal, there are a few signs that you should not ignore. Heavy or prolonged bleeding. If you're soaking through one or more pads or tampons every hour for several hours, or if the bleeding lasts longer than 7 days, you should see a doctor. Bleeding after sex. While this can sometimes be normal, frequent or heavy bleeding after sex should be evaluated by a healthcare provider. Severe pain or cramping. If you're experiencing severe pain or cramping alongside the bleeding, this could be a sign of a more serious condition and should be evaluated by a doctor. Other symptoms. If the bleeding is accompanied by other symptoms such as fatigue, dizziness, fever, or severe pain, seek immediate medical attention.
When should you see a doctor?
You should see a doctor for any bleeding between periods if you're concerned, or if the bleeding is heavy, prolonged, or accompanied by other symptoms. It's always better to err on the side of caution when it comes to your health. It's also important to remember that regular checkups with your healthcare provider can help prevent and detect any potential health issues early. In conclusion, while light bleeding or spotting 10 days after your period can be normal, it's important to monitor any changes in your menstrual cycle and to seek medical attention if you're experiencing heavy or prolonged bleeding, or if the bleeding is accompanied by other symptoms. Your health is important, and understanding your body is a key part of maintaining your overall well-being. We hope this video has been helpful, and we encourage you to seek out professional medical advice for any concerns or questions you may have about your health.